Sexually transmitted diseases are a major component of primary care and women's health encounters. For the F&P board exam, focus on clinical presentation, diagnostic testing, and first-line treatment, with attention to when partners should be treated. Trichomoniasis vaginalis is a flagellated protozoan that causes inflammation of the vulva and vagina. Patients often present with a red inflamed vulva, frothy green-yellow discharge, and the classic strawberry cervix on exam. Additional symptoms may include dysuria or lower abdominal discomfort. Diagnosis is confirmed with nucleic acid amplification testing or visualization of motile organisms on wet mount. Treatment is oral metronidazole, single dose or 7-day regimen, and partners must also be treated to prevent reinfection. Candida albicans causes vulvovaginal candidiasis. Symptoms include a red inflamed vulva, pruritus, and a thick white cottage cheese-like discharge. Diagnosis is made with wet mount microscopy, showing budding yeast or pseudohyphae. Treatment involves topical or oral antifungals, for example, fluconazole. Unlike trichomoniasis, partner treatment is not necessary unless recurrent infections are present. Bacterial vaginosis, commonly abbreviated BV, results from an overgrowth of anaerobic bacteria and loss of normal lactobacilli. Classic findings include thin, milky discharge, a fishy odor, also known as a positive whiff test, and clue cells on microscopy, which are epithelial cells with indistinct borders. Importantly, BV does not cause vulvar erythema or inflammation, distinguishing it from candidiasis and trichomoniasis. Treatment is oral or intravaginal metronidazole or clindamycin. Partners do not require treatment. Chlamydia trachomatis is the most frequently reported bacterial STD. Symptoms may include a friable cervix, mucopurulent discharge, dyspareunia, abnormal uterine bleeding, and lower abdominal pain. Some patients are asymptomatic. Diagnosis is with the NAAT test, and treatment includes azithromycin single dose or doxycycline for 7 days. Because of frequent co-infection, ceftriaxone is added if gonorrhea is suspected. Sexual partners should always be treated. Neisseria gonorrhea often presents with purulent discharge, pelvic pain, or dysuria, though it may also be asymptomatic. NAAT testing is the diagnostic test of choice. Treatment is ceftriaxone intramuscularly. As with chlamydia, partners must be treated. Co-infection with chlamydia is common, so dual therapy is recommended if both are positive. Herpes simplex virus types 1 and 2 cause painful burning vesicles or ulcers on the genitals. Primary infection is typically more severe, with systemic symptoms such as fever, malaise, and lymphadenopathy. The diagnosis is made by PCR testing or viral culture from the vesicular fluid. Treatment is with oral antivirals such as acyclovir, valacyclovir, or famciclovir to reduce duration and recurrence. Suppressive therapy is indicated for frequent outbreaks. Partners do not require treatment unless symptomatic, but education on transmission risk is critical. Syphilis is caused by Treponema pallidum and progresses through distinct stages. Stage 1 or primary syphilis is a painless canker at the site of inoculation. Secondary syphilis is a diffuse rash involving palms and soles, mucocutaneous lesions, and lymphadenopathy. Tertiary syphilis has neurologic, cardiovascular, and gummaceous complications. Screening tests include RPR, the rapid plasma reagent, and VDRL, while FTA-ABS, the fluorescent treponemal antibody absorption, is the most specific. Treatment is intramuscular benzathine penicillin G, with dosing dependent on stage. In penicillin allergic patients, except in pregnancy, doxycycline may be considered. Let's review some high-yield exam pearls. For trichomoniasis and chlamydia gonorrhea, you must treat the partners. For BV and candidiasis, you do not need to treat the partners. Remember that in BV, there are clue cells and there's the whiff test. Trichomoniasis has the strawberry cervix and motile protozoa. Candida has a cottage cheese discharge. For gonorrhea and chlamydia, the NAAT is gold standard. ceftriaxone for gonorrhea, and azithromycin or doxycycline for chlamydia. Syphilis has 3 stages. The primary is the painless canker, the secondary is the rash on the palms and soles, and the tertiary has the neurologic and cardiovascular findings. And lastly, herpes, which has painful vesicles and is treated with antivirals.